I want to go over the causes again of erectile dysfunction because I think it's very important to bring up. And the first one being anxiety and depression.
Sure. Anxiety and depression can cause erectile dysfunction. When somebody gets anxious, they produce hormones that will help them survive a stressful situation. These are our fight or flight hormones. Well, these, of course, we're not prepared to have sexual intercourse. Let's say if somebody comes up to you and puts a gun in to your head or tries to rob you.
You mean that's not an ideal time?
That's right. Well, I guess for some people it may be. They may get a kick out of that. So anxiety and depression, this performance anxiety, of course, is one of the major factors. Okay. Diabetes, you're talking about at least 10 years earlier, you're going to be diagnosed with erectile dysfunction, and about 3 to 5 times increased risk of developing erectile dysfunction. Certain medications does not mean that the patient can stop the medications, because usually what you're treating can also cause erectile dysfunction and or worse.
Right.
But many medications will have that as a side effect. Low testosterone, a very controversial and very hot topic nowadays, but can also, it's part of the fact of why men cannot get an erection. Of course, lifestyle choices, smoking, drug use, too much alcohol use, things like that.
Why is low testosterone a hot topic?
Well, it's very controversial nowadays. I think we live in a society that is obsessed with testosterone. If you open the local newspaper, and go to the sports section, you're going to see about 10 different places you can go to get testosterone replaced.
Right.
And so, yes, it is part of the reason why a man may have sexual dysfunction, but it is not the cure to sexual dysfunction.
Okay. Now, it is American Heart Month, so I want to really focus on a couple of things. First of all, diabetes. Men with diabetes are 2 to 3 times more likely to suffer from erectile dysfunction than those without diabetes. So why this connection? Why, if you have more diabetes, you're more prone to ED?
Diabetes mellitus we call fibrosis, okay? So this fibrosis, this scarring that somebody will develop in the actual erectile tissue of a man's penis will destroy their blood vessel, will destroy the muscle of the actual, smooth muscle of the actual corpora, which is the part of the penis that fills up with blood. And so diabetes is incredibly important. It's something that you should treat, that you should control, because if you don't, you're going to end up with many other health problems. The primary one we're talking about today is, of course, erectile dysfunction.